I don't remember this one. Oh, I really do bad with toxic shock syndrome. Anyway, a 58-year-old woman with type 2 diabetes is brought to the emergency department because of an 18-hour history of fever, confusion, and pain in her left leg. Okay, so already at that point, I think I was thinking like when I see like an older woman with like left leg pain specifically, I'm thinking like cellulitis without like any even thinking anything else. Cellulitis or like maybe not erysipelas, but like cellulitis is what I'm thinking. And then like she's a little fever, so it kind of helps that like she's currently infected with something, high pulse, tachycardic and normal respiratory rate, low blood pressure, diffuse erythematous rash, and conjunctival injection. I really don't know what conjunctival injection means. I think this means maybe like pus or something like that. I don't know
Mm,
what that really means.
yeah,
But
just I think just means red eye. I'm pretty sure
red
if I'm
eye.
not mistaken,
Okay.
like just inflammation.
So erythematous
Conjunctive.
rash.
Hmm.
I'm thinking like, okay, still I'm maybe thinking cellulitis. I think. Erythema and edema extend from the dorsum of the left foot to the knee. She is oriented to person but not to place. And so she may have a little bit like delirium. Um, And then I see her AST and ALT are really high. And so it says blood cultures grow gram-positive cocci in chains. And so I'm thinking at this point, it could be caused by strep or staph or strep. And I'm thinking because of that, okay, it's probably strep. And then this bacteria most likely produced by a toxin. These bacteria most likely produced a toxin that caused this patient's condition via which of the following mechanisms?
Yeah, so
And I
this
just
is
didn't know it.
sure, sure. This is a tough question. A lot of things you got to jump through, right? Going back to it, right? Diabetes type 2, right? Risk factor. If you have diabetes, just imagine that they're somewhat immunocompromised. Just in your mind, think that,
Okay.
right? Fever, confusion, leg pain, right? Fever, right? You know, it's a systemic issue already because once you start having fever, it's probably in your blood. Okay. Confusion, right? Not good because now it's probably in your brain, right? In your blood and affecting kind of your brain. And then the primary source is the leg. That's how I'm thinking about this when I'm looking. And it's an emergency. So it's an acute issue. You see how I
Mm.
worked through that?
Yeah, yeah.
Just by one sentence. That's what I'm thinking. Okay. And then you have 103.3 fever, very high fever, not good. She's tachycardic, right? At a pulse of 124. Respiratory, she up to tachypnic, right? Over 20 is rapid, right? And then blood pressure is low, hypotensive. So immediately I know she's septic. Okay. Physical exam shows diffuse erythematous rash. Diffuse erythematous rash with conjunctival injection. We know that she's already sick from her leg, right? Dorsum to the foot. So yeah, we know that her leg's infected, and also it's in her blood. She's oriented to person but not place or time, so she's confused. We already know that too from the first sentence. And then you got your serum, right? Your creatinine's messed up, kidneys are messed up. BUN or urine urea nitrogen is elevated. So that just says your kidneys are hit, right?
Mm.
Albumin is hit too, right? And so you know that there's a breakdown of blood somewhere, probably, right? AST, LT, so your liver is also damaged, right? So in your mind, you should be paying this lady is really sick. Okay.
Mhm.
And then they did blood cultures that grew gram-positive cocci chain. So in your mind, you know that strep, right? Which of these bacteria most likely produce a toxin that can cause via which of the mechanisms? Okay, this is where the jump becomes a little bit difficult, right? Because strep pyogenes, right? You do know like they have a different toxins, right? But right, it's you kind of have to relate this, right? When you're dealing with strep and staph, they're in a sense they're somewhat similar, right? They have a lot of similar profiles, especially with skin, right? If you have really bad skin infections, staph and strep are kind of your two main big players,
Okay.
okay? And so you have to make that connection, be like, oh, it's a skin infection. There probably has to be something like toxic shock syndrome, right? Which is this. If you remember Staph aureus, right? It kind of attaches here and makes your body go haywire. Okay. Same kind of issue if you have, I think if you have like a tampon in too long, right, you can have
Oh,
toxic
yeah.
shock syndrome, right? Same idea, right? But these other things, right? If you talk about like CAMP, right? If you have, I can't remember some of these, right? CAMP, I'm thinking more like the diarrhea stuff, right? And then I think oh man, I can't now. My brain is now like, oh, I can't remember the specifics. Okay, the reason why I remember this is because this toxin or staph toxin it attaches to your MHC class 2 and it goes like it keeps firing off inflammation, which is really, really bad.
Mhm.
So, but yeah, just kind of look back at these. I cannot remember some of these because these are getting into specific micro. I know like the CAMP stuff is a lot of the diarrhea things. I want to say, which one is this one here? Let's see. Let's look at it together. Maybe I can remember as I read these.
I actually don't know what you mean, like the diarrhea things. Like, what do you? I don't. Oh, it is very much so.
Yeah,
Oh, like yes, okay,
like
like
E.
Vibrio.
coli, Vibrio. Like I remember clinical things. You know what I mean? So I'm trying to remember. Like I just remember that stuff makes you poo a lot. Watery diarrhea is the CAMP stuff. I know this is how I remember things. Sorry. So
No,
I'm just
you're
trying to remember.
good. You're good.
Yeah, and then this one I didn't know. This is a new one. This glycosylane row one. I didn't remember this is
Detoxin
Clostridium.
of Clostridium.
But yeah, and then you have things like cleavage. What is this? This is anthrax, right? These are stuff that I don't remember. Shigella, you have to know. HUS and Shigella like toxin like E. coli. They test this a lot with the ribosomal. So
Uh-huh.
yeah, but yeah, I'm trying to get you to think of kind of on the clinical standpoint because this lady is super sick, so you got to pick a toxin that makes you super super sick. So okay, working at those.
Here it was kind of it's a biostats question, and it's from just I remember Colby explained this to me pretty well. At least I thought he did. It was saying like you have this really, really like fatal disease if it's not caught. It's like where would you want the cutoff between normal and abnormal to be? And at first I was thinking, I don't know, I just didn't really think that you would really want a super, super sensitive um test because if you don't catch it, then they'll die. So you want the most sensitive test possible for a super, super rare disease.
Okay.
And you'd rather have a lot of false positives than
Yeah.
false negatives.
So let's just talk on a test taking standpoint. Okay. Um, it's always going to be A or E. It's your extremes. Anything that deals with extremes, they're never going to test you on in the middle. So
Really
BC
interesting.
and BC and D are like horrible answers. Either you got to pick something super specific or you got to pick something super sensitive because picking something in between is never going to be your answer. Okay.
Mm.
So it's either so now you got it down to 50-50. Okay. So B, C, and D, bad answers. Never pick those. Okay. Has to be
Okay,
extreme.
cool.
Okay. So then the question becomes now, okay, do you want something super sensitive? And what you said on a clinical standpoint, that means it catches everything under the sun, right? Even things that you're not supposed to catch is going to catch it, right? Or do you want
Yeah,
something that just catches the rare disease? Well, if you don't want to miss something, you want something super sensitive. That's all you have
exactly.
to think about, right? If you don't want to miss something, right? Like for instance, giving you an example, cancer, right? Never want to miss cancer, right?
So you
So
want the
when
thing
you
that's gonna catch it, even if it's in like the smallest amount possible, so you can like treat it. You don't want to
well,
miss
it's
it.
not only that, right? Think of it like this. Sensitivity, I want you to get a clinical sense of what that means. So if I want to test something very sensitive that is like for cancer, giving you an example, right? So let's say we're screening for skin cancers, yeah?
Mhm.
Okay. And I'm going to do a very sensitive test, meaning that I'm going to have four physicians look at your body head to toe. Okay. When you're naked, head to toe, look at it, right? For any kind of lesion, right? And any kind of lesion that I see, if it's a different color, if it's a mole or whatever, I'm going to tag it as potentially cancer. I'm never going to miss cancer, but that's very specific. It's not sensitive, right? Because every lesion is not cancer, but it's like, oh, I caught, 10 benign moles. Is that necessary? Probably not, right? But it's very sensitive. You get what I'm trying to say, but not specific.
Yeah.
Okay. Something super specific is I'm only examining you if it has the ABCDEs, right? If it's
Okay.
asymmetric, bad borders, irregular, evolving, bigger than a certain size, right? But that means that's not very sensitive. You get what I'm trying to say?
Yes. So
You
sensitive
get the
is kind of
difference.
in the terms of like it's gonna catch the, I mean, in this case, like the abnormalities, not just the exact thing you're looking for.
Exactly.
And it's gonna
Yep.
catch the things that are like that could be related to this that may not be, but it's not gonna catch like, for example, like if we're talking about lupus or something like that, you're not looking at um all the different characteristics of that. You're just saying, hey, this could be associated with it. This is like an abnormality that could be associated with it. Kind of like
Exactly.
that.
Yep. Exactly. So
Okay,
the
cool.
most sensitive thing to say that you're sick is what? That we use in our daily, as physicians is fever, right?
Mhm.
Fever can mean anything. It can mean viral, bacterial, you ran too much, you're too hot, right? Cancer, right? It could mean anything, right? Drug reaction, right? So fever is very sensitive, but not specific for any one disease. So that's why, when someone's sick, they always say, I have a fever, meaning you're sick. We don't know what you're sick with, but you're sick.
Exactly, because that tells you nothing. It just says,
Yeah.
hey, yeah, you're sick. Okay,
Yep, that's
cool.
all it tells you. You're sick with something. I don't know what you're sick with, but you're sick with something. But if you told me, oh, I got a strep swab and that came back positive, that's very specific for strep.
Okay.
That's the difference clinically. Because I think in biostats, what happens is when you talk about sensitivity, specificity, all you're thinking about is the numbers, but you don't actually understand what sensitivity and specificity mean. Right. So I'm trying to relate it clinically so you can understand, because a lot of people just memorize the biostat stuff. And then when it comes down to, oh, how do I actually use that in real life? They're like, oh, why would I ever need this? Well, I mean, we use it in our, in our language of testing. When you're ordering certain tests, some are more sensitive than others, and some are more specific than others. So it depends on what you're looking for, right? If you're looking for something that's a catch net of all, you want high sensitivity. If you want something to confirm a diagnosis, you want something very specific. You get the
Makes
difference?
sense. Yeah, completely actually.
Yeah. So way different. Different goals of the test. All right. This one.
At this point, I really hadn't looked at like the sagittal view of the brain, and it was a pituitary tumor. I think that she had, yeah, galactorrhea. It was a prolactinoma. I think I very much knew that, and I was like, I just don't know the
Sure.
exact structures, and so looking back at it now, after looking at this exam and then even reading the neuro chapter, it is pretty clear it is D.
Yeah.
Um, and so, yeah, I know that now, but that's kind of what this question was
Sure,
about.
sure. Yeah, for sure. I mean, an easy way. I mean, man, 3 ENT questions. So after today, you're gonna be a whiz of ENT.
Let's get
Okay.
it.
So one of the things that you want to look for a pituitary, easy, right? To kind of look for is that it's gonna be right behind the sphenoid sinus. Right? Here's your sphenoid.
So that's why you would do though, and I know this is like completely random. The sphenoid sinus, that's why you would do a like transsphenoidal resection, right?
Bingo. Yeah, I just did one yesterday. But
Oh,
anyways, yeah.
shot. That's cool. That's
Yeah, so you take down all these anterior posterior ethmoids, right? You put the scope here, right? So that you help the neurosurgeon kind of view it. And then the neurosurgeons would kind of drill this area down and then take out the tumor from right here.
dang.
Okay. So yeah.
So just to be clear, I think that C is the thalamus. I think.
Yeah, that looks
Um,
great to me. C looks like the thalamus. Yep, it is the
um,
thalamus. What is A?
B and yeah, I forget. A is
Hypothalamus.
hypothalamus. Okay.
Hypothalamus, thalamus. B, I think, is the midbrain. Yeah, midbrain, and E is the
Pons.
yeah, pons. Yeah.
Pons. Yeah.
So pons, midbrain, thalamus, hypothalamus, which now makes sense to me because I mean, like I said, my brain stuff sometimes I have to refresh, but thalamus, hypo under the thalamus, right?
Hmm.
Hypothalamus. So that makes sense.
But I looked at this question, I was like, dang, I'm just gonna miss this one.
No, that's
Yeah.
okay. All right, perfect.
Okay, I thought I had this idea down. I guess I just didn't. So is a 5-year-old boy who's stung with a bee, stung by a bee, and it says like there's the extravasation accumulation of fluid is most directly related to which of the following. And so I thought it was just like vasodilation caused by histamines. I thought that's what histamines did, but apparently it was not that.
Yeah, so this is part of it, right? But the key thing, even if you have vasodilation, right? So I always draw this for my vascular questions, and you can kind of think about it like this too, because it makes it easy. Oh shoot, that's a horrible drawing. Let me draw that again. I can't remember where I learned this from, but arterial side to capillary side to venous side, right? Okay, and the reason why this is kind of bulged out here because your tissues here and you have endothelium, and so it gets really thin here, right? And so when you're talking about extravascularization, right? So your interstitial space, which is just kind of this like space right here. Okay,
Hmm.
the only way fluid can leak through it is these endothelium cells, right? Form gaps, right? Which happen during sepsis, which happens during histamine release, which happens during a lot of things, right? So then you have fluid that leaks, or serous fluid that leaks between these, and that's how you become edematous. Okay.
Mm,
The
okay.
vasodilation does help. It brings more fluid to those areas, but what actually leaks from the capillaries out is these endotheliums kind of creating the space so that the fluid can go through. So
Smart. Okay. That makes sense too. I guess if you have like the cells in a row and you increase like the amount of distance they have to cover, there would be naturally just be gaps that can leak
yep,
out neutrophils and things that can help fight the infection.
yep.
Oh, this was hard. thought I could get. I knew it was ADHD from reading this. I knew it was like methylphenidate, which is a stimulant. Um, Now that I look back at it, though, I don't know why I didn't choose stimulation. I was between. I got rid of all the stimulation ones, even though that was wrong, and I just didn't know. I think I still would have missed this question because I just didn't know what the excitatory amino neurotransmitters were. I knew there was like glutamate and stuff like that. Oh, maybe I do know this actually. No, the biogenic ones are like norepinephrine, dopamine, stuff like that. But so I'm not really making sense.
Yeah, this is kind of interesting. I mean, yeah, you just have to know that they release. I mean, they help stimulate releases like norepi because it's a stimulant.
Yeah.
That's the first place you start. So then you get it between AC and E because they don't block anything. They just help release stimulants, right?
Mhm.
Stimulation or release of inhibitory amino acid. No, that's like a double negative or a positive and a negative, right? You need a double positive, right? So E's out of the question, right? And then you get it between A and C, right? This is where it gets a little bit confusing, right? It says biogenic immune neurotransmitters, right, versus exotic amino acid neurotransmitters, right? This is kind of the reason why when I back and I this is a question that they used back in the day. The reason why I chose C is because biogenic means like natural, so like it's
Oh,
norepi. That's how I thought of it. I'm not exactly sure what their explanation for A is. Let's see. Glutamate
yeah. Well,
exocytic.
excitatory and like amino acid neurotransmitter would be like glutamate because that's the one that is excitatory in this body.
Gotcha. Gotcha.
And
Yeah.
yeah,
So biogenic means just natural storage of, epinephrine,
norepinephrine,
norepinephrine,
yep,
things like that. So
serotonin. Got it. Yeah. I looked at this question. I was like, what the heck is it?
yeah.
Um,
Yeah,
Man,
just
this
remember that it's
one.
just secretion, right? So this one here.
So this one was annoying to me. I remember just reading these like was one page in GI. Anyway, it says fatty acids are infused into the proximal small intestine of an experimental animal, and it said which of the following is the most likely change in peptide secretion. And so I was like, man, I know that there's like one that rather responds to increased fatty acids or causes increased fatty acids. And for some reason, the only thing in my head was secretin. And I just kept saying, I'm just gonna go with my gut. I really don't 100% know this. I spent way too long on this one, like admittedly. I probably spent like 3, 4 minutes on this question because I thought I could get it right.
Yeah.
And
Yes.
yeah,
Sometimes, you kind of just pick an answer. Like this is kind of one that either you know or you don't.
yeah.
Um, but yeah, this is a memorization. This is GI physiology, or I guess exocrine function, right? In particular. So
Hmm.
ah,
Man, this is embarrassing.
hey,
Um,
did we go through another X length or is different test probably? But yeah, this is a yeah, they're trying to figure out do you know how to read this chart? So
so yeah, and I kind of need to go back over these two diseases. I know that we kind of went over skid a while ago.
yeah.
Um, but man, I was thinking like, okay, CD3. Obviously, like it's crazy high in CD3, low in IgM. Now that you had told me about it, I kind of had forgotten that SCID was revolving. Because talking about B cells and T cells, right?
Yep.
And because T cells, I believe, are like, is it B cell? No, T cells are CD like 2 to CD8. So they're saying that the T cells are there, but the B cells aren't. What is it? Right?
Let me see. CD no, so CD3 and CD4, those are your like CD4, CD8, right? Those are your T cells,
Oh, those
right?
are T cells. T cells, yes.
T cells. So the issue with think of it like this, right? So when you're reading this chart, right, you have you have your you have your T cells, right? Okay.
Mm-hmm.
The issue is you have your T cells, but the reason you have to make this jump, the next jump in logic is actually IgM is just a it's indirect marker, right? Because to create antibodies, right, like IgM, you need class switching, right? Which you need B cells. Does it make sense? So if you have T cells but no, B cells, then you're not going to be able to class switch to make IgM.
Yeah. So
Okay.
it's
So
saying that
so
there's, yeah, okay.
so indirectly, you should have kind of guessed like, oh, okay, so he has no B cells, meaning it's
A gamma
X-linked A
globulinemia.
gamma globulinemia, right? Which, if you look here, right, there's no globulin, so then that's kind of your next. But going back to your ADA, adenosine deaminase deficiency, right? This is SCID. Okay, this causes you skid, severe combined immunity. The reason why it's called combined is you're missing T and B cells.
That's big. Yep. Yep. Because I
Okay,
always
so
got that confused. I
that's
always get them confused. I was like, I don't know which one is like just B or just T or, and so yeah.
yeah, so that's kind of, when you're thinking about it, that's what you're really thinking about. Okay, so skid, anything that causes B and T cell is considered skid, right? Meaning it's like they're very, very sick because they have no issues. But something that I always kind of, on a test taking standpoint, anytime you have a boy with an immunodeficiency, you always go to Bruton's first, which is X-linked acholonemia, right? Because it's X-linked, so it's mainly going to be boys, because
Mm.
females can't get it because you need two traits. You need two X-links to get it, right? You get what I'm trying to say?
That makes complete sense. Yeah. When you have an X and Y for a male, it's going to be most likely they have the condition.
Yep.
Um, I was going to ask you, I don't know if you remember 100%, like with skid and X-linked, I always really look at like what they're being infected with. Is that more of an issue? Like, would you necessarily focus on that between these two? Would you say, okay, it's 2-year-old boy who has recurrent sinus issues. It's probably gonna. I'm not like before reading anything. It's probably gonna be Brutons. Like, I need at least to have that in my mind.
Sure.
Brutons with a boy.
Yep.
But what makes you think, oh yeah, it's probably gonna be skid now? Like, is there
Uh,
like an infection
yeah,
that like,
yeah.
oh yeah, that's skid?
So skid is, like I said, skid is, I mean, how do I say this? To me, on a test, it's Bruton's until proven otherwise. The only way it's proven otherwise is if they give you like some extra information. Okay.
Okay.
So for instance, they give you this chart, there's no dots on it. That's skid. Okay.
Oh yeah.
Or on a clinical standpoint, skid people get sick with everything, man. Viruses, bacteria, fungal, right? They
They
get
have no
all,
immune response, right?
yeah, no immune response, right? They're like the bubble boy, right? So on that, on a clinical standpoint, but like I said, on a test, they're not giving you they're not giving you a boy um with skid usually, unless they give you more symptoms, right? Or they give you more information. They're not going to just give you a boy that's sick. Is it skid or X-link, right? That's not fair. They got to give you something. You know what I'm trying to say?
Yeah, 100%. Yeah, I should have got that one, but yeah, okay. I'm glad that you would kind of cover that up, just using the words that are in the condition. But like combined is B and T linked, or B and T cells are going to be deficient,
Yep.
and A gamma globulin, obviously gamma is going to be B cells are going to be deficient. And
Yep.
so, okay. Um. Okay. Mildly obese 42-year-old woman comes to the physician 2 days after sudden onset chest pain and intermittent cough while she was doing laundry. At this point, I'm not thinking much. I'm just thinking sudden onset, so it's acute condition. She's an obese woman. Just kind of keeping that in the back of my head. Medications include oral contraceptives. I When I see that, I know it's supposed to mean something. Like she's on hormones, and so she may have I don't really know what necessarily that could tell me. I'm not gonna lie. She has smoked 1.5 packs of cigarettes daily for 24 years, so smoker, and she seems somewhat anxious. An X-ray shows the chest. An X-ray of the chest shows normal findings. So I guess there's nothing like dramatically apparent there, like no no pneumonia, anything like that. And an ECG shows sinus tachycardia. Okay, ventilation perfusion lung scans show a defect in the anterior inferior segment of the right upper lobe. It says
Okay.
collateral arterial flow is provided to the area, to this area by which of the following arteries. And so I think that was just the main question, like what's basically providing blood flow to the right upper lobe. And apparently
Mhm.
it's always bronchial and pulmonary arteries.
Yeah. Yeah. So I mean, if on an answer standpoint, right? But if you want to work through this clinically, the best way to answer, like, I think you're already thinking clinically through it, but let me kind of add some stuff here, right? So you have 42-year-old woman, right? Sudden chest pain, intermittent cough. So in my
Yeah.
mind, I'm like, that's an acute issue, right? Medications include oral contraceptives. Okay, this is going to be important. The reason why, and then she's a smoker. Smoker plus oral contraceptive is like very bad clotting. Okay.
Mm.
It increases your clotting, especially, just remember that in your mind, right? So like estrogen pills, things like that. If you have oral contraceptive and you smoke, you're a huge increased risk of clotting. Okay, just remember that. Okay, and then X-ray normal, EKG shows sinus tachycardia. So in my mind, I'm already thinking she has a PE.
And I was kind of leaning that way anyway, but I remember I was looking at the answer choice. I'm like, this doesn't make sense. But anyway, yes, PE.
Yep. And then also on top of that, right, the ventilation perfusion lung scan shows a defects in the anterior inferior segment of the right upper lobe. That confirms PE, right?
So I
Because
thought
there's no
PE
flow there.
though
Say it
was
again.
very like emergency, like you're about to like it's like sudden death.
So you're thinking about a saddle embolus, which is completely different. So
Oh, okay.
there's different amount of PE. So think of it. I'm gonna give you a different motif here. If I have a clot in my toe
Mm-hmm.
and the toe dies, that's fine, right? I'm not gonna die, right?
Yeah, you're not gonna die.
But if I have a clot at the proximal segment of the femoral artery, my whole leg is gonna die. You get the difference?
Yes, it
So
just
if you get
depends
a
on how high
PE,
up or yeah.
exactly. So if you get a PE right where your pulmonary artery is, right? That's not good, right? You cough
That's
the
a
whole thing
saddle.
off. That's a saddle embolus. That means you kill your whole lungs, right? Meaning you can't breathe, you die, right? But if you have a very small PE that lodges in one lobe, one lobe of one side, you can still breathe. I mean, it's uncomfortable and you need to fix this, right? But
Mm-hmm.
you're not gonna die. You know what I'm trying to say?
Mm-hmm.
So there's varying degrees of pulmonary embolism, is what I'm trying to tell you. So okay, perfect.
Very cool. Very cool. Oh man, this was embarrassing. I just read this. I kind of looked at this and I thought there had to be math done.
Mm-hmm.
Because I was like, I know how to do relative risk. I knew that formula, and so I was looking for math, but it was as simple as just so this person on the active drug has 0.44 to 0.89, and on the I forget the other one on this other condition or whatever, the risk of disability and risk of mortality. And the risk of mortality, it includes the number one, which means it's no significant difference.
Bingo. That's it.
And so that's literally it. I just thought there had to be math done, so I freaked out.
Yeah. This is like I said, some of these things, right? If you kind of break it down, like how do I interpret this information, right? Like I think you understand that if it contains one, not significant, so that's good.
Yep.
So
Yep.
the relative risk, if it's less than one and it's the interval doesn't contain one, then you decrease your risk. So
Yeah, that's good.
yeah, and if it's over one and it doesn't contain one, then it'd be higher risk.
I was wondering, I guess we had that wrong at first because we were thinking like, well, obviously the drug is going to help, but we don't know that.
Yeah,
Um,
yeah,
so it's
exactly.
just if it's lower than one, it's going to decrease. If it's higher than one, it's going to increase, but it'll be significant.
Yep, exactly.
Okay, cool,
Significant.
cool, cool. Oh, I didn't like this. I think this is something that I feel it's like a step two type question. Basically, you know,
Yeah, it is for sure. I mean, if you know, going back, right, it's kind of understanding. It's actually an anatomy question if you can actually see it, right? Just remember, I mean, this one I'm going to talk a little bit fast on because I think like you said, it's a little bit just an anatomy question if you think about it, right? You inject dye, right, fills the uterus, right, and then kind of your fallopian tubes. If you look, it fills the fallopian tubes, right, and then all of a sudden there's spillage of contrast. And then you have to ask yourself, why is that the case? Because remember,
oh,
right, your
right.
ovaries have your fimbrae, right, that kind of go
You're
here, but
complete. Yeah,
it's not connected completely. So there's a space that goes that contrast is going to spill because it's not a closed circuit. So that's the reason why.
that's insane. Yeah, that's
It's
crazy
just
because
anatomy.
yeah, exactly. Because I've seen that before. Like the ovaries don't necessarily like 100% like closed circuit connect to the fimbriae.
Yeah.
Exactly. Man, okay, I just messed this one up. I know the blood clotting pretty well, I would feel. And I think it was just saying like it says there's a issue against the platelet 2B3A receptor. And I know that ADP and fibrinogen kind of deal with that. But
Mhm.
ADP is gonna, I think, like encourage like the formation of the G2, the 2B3A receptor, and fibrinogen is gonna be the one that actually binds to it.
Yeah.
It connects different platelets together to do aggregation.
Perfect. Perfect. A little bit of memorization here for
Yeah.
sure.
Man, this is frustrating. So it just said like which of the following is the most likely origin of the stimulus of cortisol? And I just knew it was from the pituitary gland, but I just didn't know if it was acidophilic or
Yeah.
basophilic.
This is another memorization one, but I think, you have it kind of you
Yeah,
just have to kind of memorize it. This is nothing else but memorization. So,
yeah,
but you got
yeah.
enough
There's a
to
little
divide.
mnemonics for it now. So I got it.
Perfect. Okay, this one here.
Oh man. This is a Hardy-Weinberg, and after doing this question wrong a million times, I've kind of just given up on them.
Sure, I can teach you a
Honestly.
way.
So I saw this and I'm like, I can do like I think this is pretty clear that you had like cystinosis. It's a recessive disorder, autosomal recessive disorder affecting cystine transport across the lysosomal membrane. And this is not cystinuria though, right? I had a question about this today, and I was kind of like, I don't never ever heard of cystinosis.
Yeah, this is something different. Just to be honest, when I'm reading these questions, I don't even, don't even think clinically. You just know it's a Hardy-Weinberg question.
Mm-hmm.
Okay, so these are your two formulas you always have to work with, right? And then they say the incidence of this order in the general population is 1 out of, you know,
40,000.
40,000, right? Okay, and that's like people that actually have the disease, right? So like Q squared, right? Q squared is like your recessive, two recessive traits, right? Q squared.
Uh-huh.
So then, right, to find out Q, you just square root this, right? So then that becomes 1 over 200, right?
1/200.
Okay, so far so good.
Yes.
Okay, and then, right, you want to find out your P, right?
You're just kind of
So
connecting the puzzle pieces.
yeah, so P is okay. I mean, I've done this so many times, but yeah, P is equal to 1 minus 1 over 200, right? But would you also agree with me that, P is about 1,
Yeah, it's so small. It's like, yeah, like what
right?
is
It's
it?
about 1,
It's
right?
about
So,
one.
yeah, so now they're asking you, okay, the wife's history is not going to do wife's risk for being a carrier of this disorder is closest to which of the following? A carrier is 2PQ in this formula, right? So 2 times 1 times 1 over 200 is equal to 2 over 200, which is equal to 1 over 100.
Oh my gosh.
Easy, right? It's not that
Very
hard.
easy. Very, very, very easy.
Yeah.
Actually,
Yeah. So
when
these
I see these
questions,
questions, yeah, I'm like, I'm just not because I don't know.
yeah. So whenever I see these questions, these should really be gimme questions because usually when they give you that huge fraction, you're like, oh, I got to square root that. Okay. So that gives you Q. Okay. And then P is equal to always about 1 because 1 minus Q is always about P equals about 1. And then you just plug it into 2PQ, which ends up being you just half the fraction there. So it becomes, instead of 1 over 200, it's just 1 over 100.
Cool.
Yeah, so
Cool.
that's one way to do it. If you get another, there's some tricks to it. I'm trying to think of what's the other trick that they usually ask. Oh, what are the chances of like, you know, what are the chances of man, I'm trying to remember the scenario because they do ask this a lot. The trick
And
to
when you're
this.
done with that, I have a question for you because I actually have a very bad weakness with they'll give me something and like based off of like, oh, my mom's sister had it and my dad's uncle had it. What most likely is it? It's like a shot in the dark for me, even though I feel like I know it. Anyway, yes, please keep going.
Yeah, yeah. So Hardy-Weinberg, I was trying to say there's a certain question. I just can't remember how they phrase it. I'm trying to remember. So it's like they give you, let me say this. They say, let's say, okay, let me try to, so you have mom and dad. Okay.
Mhm.
Mom and dad. Okay, and you have son. Okay, and then freaking give me a second.
Very good.
I think they say son is a carrier of some kind of rare disease. Um, man, what is the scenario? I'm trying to remember. Well, give me 1 second. Let me
No, you're
think.
good.
It's like,
Actually, I'm gonna use the restroom real quick, and I'll give you. Is that okay?
yeah, yeah, go for it. I'm trying to think of it. Let me remember.
Yeah, I'll be right back. I'll be like 2 minutes. Okay, I'm here, bro.
Yeah, I couldn't figure out. I mean, if you ever get one of those questions, Hardy-Weinberg, it's a little bit of a. This is kind of a straightforward Hardy-Weinberg question, but if you get one
Yeah.
that's a little bit tricky, just kind of flag that question down. We'll go over it next time. I can't remember off the top of my head, but it deals with like someone's a carrier, what's their odds of having a child that is also a carrier, or something like that. And you have to use it. There's a little trick to it. You have to use the fractions of 2/3 instead of 1/2. And so
Yeah.
that's what they always ask. But if you ever get that question, just let me know. We can go over it.
Dude, but like again, I don't know if you think about it a certain way or if like I tend to miss like if it's autosomal dominant, X-linked recessive, like if only men have it, like it says like this random disease has only men. Like, what is it? Or like, if it's only women, what is it? I don't know. I don't know if you have any way of thinking about those because I miss those a lot.
Yeah, I would say you have to just break it down into the words. So for instance, they say like mainly male, then you know it's X-linked. X-linked, in particular, X-linked recessive.
Mm,
Okay, because if it's X-linked dominant, then
dominant.
females will have it too. And then also on top of that, right, if they say something like, oh, you know, if it skips a generation, meaning let's say this is granddad and grandma, right? And then they have kids and son marries somebody else, right? You know, son with else, and then they have kids and you know, they had the disease up here, skips a generation, and then you know, their offspring have disease, then it's likely recessive, right?
Mm,
Because you need two carriers, right? So I'm trying to think of what else they usually ask you. If you have somebody that has autosomal dominant that you know marries somebody that is, you know, let's say it's an autosomal dominant disease and they marry somebody that obviously doesn't have the disease, hopefully they're not marrying someone with the disease, but it's somebody that doesn't have the disease, right? Meaning it's, you know, big R, little r usually, and then RR. That means 50% of a chance that their kids have the disease, right? If it's autosomal dominant,
yeah.
right? And the reason why you might be thinking like, oh, but how do you know that, how do you know that the parent doesn't have big R, big R? That's because most of these autosomal dominant diseases, if you're homozygous autosomal dominant, you die in utero. It's like not sustainable with life. So it has to be always a carrier. Does it make sense what I'm trying to say?
Yeah, that does. That
Like,
does. Okay.
yeah, like for instance, like you know, dwarfism, right, or achondroplasia, right? That's
Mhm.
autosomal dominant, but you know, they're always just the carrier of the autosomal dominant because if you actually have, you know, big R, those will
They're
actually
dead.
die because
Yeah.
it's not compatible with life. So
Yeah. Here I kind of just, I'm not gonna lie, when I see this, I'm like, well, we'll see if we can just make a guess.
sure.
But when I see this, it says the most likely underlying cause of this patient's memory deficit is bilateral injury to which of the following labeled structures. And so it says a 27-year-old woman has amnesia after losing consciousness during a suicide attempt. She tried to commit suicide by an automobile with the engine running in closed garage. So that's going to be the carbon monoxide poisoning.
Mm-hmm, mm-hmm.
Um, and I believe there is a, oh my gosh, I'm making this connection now. But like I know there's a brain issue with carbon monoxide poisoning that you can see on MRI or something, or CT, something like that.
Yeah, they
Um,
just said hypoxia. I think the main thing here is they're trying to test you. Do you know where kind of memory is formed? So limbic system is kind of where they're saying, which is E temporal lobe kind of
yeah.
area where the
It seems like
hippocampus
they
is.
always have two or three questions like with real live brains, and they're just like, hey, which area is this?
Yeah. This, I mean, this I would say is, I don't know. I don't see this kind of cross section as much, right? Usually it's like a spinal cord or, you know, they give you kind of the outside of the brain kind of saying, you know, if you have an ischemic infarct, which one of these will deal with the foot versus the rest of the body? Things like that. I see this
Yeah.
not so much. This is pretty rare. But yeah,
Okay.
like you said, you kind of, if you don't know it, you pick it and then you kind of learn from it. That's the best way to go about these
So
questions.
limbic system is E.
Yeah. All right. Let's go to the next one here.
Um, Most likely explanation of this patient's symptoms. I don't remember this one actually. I think I thought this was okay. Let me see. Let's read it again. I'm sorry. A 24-year-old woman, G1P1, comes to the physician because of nervousness and tremor since the delivering of her healthy female newborn 6 weeks ago. So I actually just learned. So this is I just made this connection because I missed it here and then also on MD Boost. I missed it a couple times where if you're basically having a woman who has endocrine issues, if it's usually hyperthyroidism, um,
Mhm.
it's most likely postpartum thyroiditis. And that's not because I think I just thought this was Graves' disease. That's about it.
Gotcha.
And
Yeah.
so I didn't make the connection like, oh yeah, healthy female newborn 6 weeks ago. It's in like within a year, I think it's can be considered postpartum thyroiditis.
Yeah.
Um,
Yeah.
and
This is
so
just kind of one of those things you have to kind of learn about postpartum thyroiditis and the fact that it does happen, right? And I'm trying to look at kind of what else I can kind of give you here.
well,
Um,
what do you see? What do you think of when you think of Graves' disease? Do you think of like older ladies? Do you think of like
yeah, no,
um
it can be younger people for sure, but the I think the lab values are going to be different. So we'll take a look at this, right? free T3 or T4 is only, is still within the normal range, right? TSH is less than 0.3, right? So that means that, your TSH is suppressed, right? But the key thing is 24-hour thyroid radioactive iodine uptake is 1%. So that's less than normal, right? So things like, I mean, now we're going to get a little bit into endocrine,
Like the
which,
cold nodule and the hot nodule.
yeah, so this test isn't really done anymore unless you have a hot nodule, right? A hot nodule is, or Graves, that can confirm it, but a hot nodule would mean that this one adenoma or nodule is secreting out a bunch of T3, T4, and if to be able to create T3, T4, okay, you know why they're called T3, T4, right?
Try iodine.
Yeah,
Yes.
how many iodines you need, right? To create it, right? Some
Yeah.
need 4, some need 3, right? So if you were to have an adenoma, right? This radioactive iodine, when you take a picture of it, this one singular place would light up. Does it make sense? But then
Yeah.
if it's Graves, what do you think is going to light up?
The whole thing.
The whole thing. Does it make sense? It's the
Diffuse.
whole
Yeah.
thyroid, right? The reason why is because you have the antibody on your TSH receptor, right? But the key here is that the thyroid is not producing anything. This is what it tells you, right? The radioactive uptake is 1%. It's low, meaning your thyroid is not generating new T3, T4. So you know it's not Graves. Does it make sense?
So kind of actually. So I thought with a low, it's saying it's uptake though. So what does that mean? Like the uptake of iodine? Is it
Yeah,
not
the
saying?
uptake. So imagine this, right? So pretty much this radioactive iodine, people get confused about. It's not really that special. It's just what you do is you give the patient iodine that's radioactive, meaning that it's tagged. Let's say it's tagged with a marker. Okay, so iodine
Oh,
molecules floating in the blood. So if it's Graves, the Graves will suck up the iodine to pump out T3, T4. Does it make sense?
so it'll be a lot higher than
Oh yeah,
25%.
this is gonna be like 50%. I'm just making up a number, but it's gonna be very, very high because it needs iodine to be able to pump out more T3, T4, right? But if
Okay.
this is low, that means that it's not creating its own T3, T4. It's just spilling whatever it has already in there. It's not making new T3,
That
T4.
makes complete sense. So in the adenoma or like the one area, like the one area of the thyroid that's being, that's why it's so low. Because it's not the whole thing that it's catching. It just is a little one area. So it's very
No,
low iodine intake.
no, are you talking about the thyroid adenoma?
Yeah, is that not what you're
No,
saying?
the thyroid adenoma would also be like 50%. But when they take a picture, like for instance, you do a nuke med scan, like a radioactive iodine like nuke med scan, it's going to be this one area that lights up. I'm talking about imaging.
Oh, so okay, so in this patient postpartum thyroiditis, it's saying basically, hey, it's not Graves is not an adenoma.
Exactly. That's what
That's
this
what they're
number is
saying.
telling you. Yeah.
Okay,
Yeah,
okay.
the
Imaging
low
there too is
number
okay.
is this low number. Just think of it like this. This low number is telling you that the thyroid is not making new T3, T4, but it's leaking out its storages of whatever it has. That's why she has some symptoms.
Okay.
Okay, but if it's making more, meaning this would be elevated, that would be an adenoma or Graves. And then you might be asking, oh, what can you do to figure out if it's Graves or an adenoma? Well, then
Take a
you can
picture of
take
it.
like a picture, like an image. And then if it's an adenoma, then you have one nodule that's going to light up like a firecracker versus Graves, the whole thyroid will light up. So that's
Makes sense.
the
Makes
difference.
sense. Okay. I think so. I just didn't know if for this person, if the vagus nerve was going to cause stimulation, was basically going to contract the esophagus, the lower esophageal sphincter, or if it was going to relax it. And apparently the vagal stimulation relaxes it, which didn't make sense to me, but that's I guess the fact of the matter.
Mm.
Person
Yeah,
basically
I
had, yeah.
mean, relax and digest, I guess. That's the best way I can remember.
Hmm.
Yeah, something you can remember is just relaxation there.
Yeah.
Nothing, I don't know if I can give you any more than
No, you're good, yeah.
that. This one here.
Um, oh, it said, this was dumb, but the patient's cancer is most likely arose from which of the following, and it said that it had a cytokeratin type. And apparently that just means epithelial cells. When you see cytokeratin, like Desmond means muscle. I thought there was something that I read that said cytokeratin like 5-6 or something like that was like neuroepithelial, neuro cells. Like, what is it with
Uh,
like small cell lung cancers? They have like synaptophysin and chromogranin. Those are
yeah,
like
that's yeah, those are different. Those are going to be kind of different. Cytokeratin, just keratin in general, that's just like your epithelial, your skin cells. So
yeah, yeah,
yeah. Neurons and also, like your neuroendocrine. The reason why they're called neuroendocrine is because they'll release endocrine, right? Endocrine hormones. People, I mean, I didn't make that connection until way later in medical school, but neuroendocrine, if you think about it, right? Small cell lung cancer, right? Small, right? Cell lung cancer, right? That is neuroendocrine because that's why it has all those paraneoplastics,
yep. It's
right?
gonna be
Because it's
like
secreting
FADH,
basically, yeah,
Lambert-Eaton.
exactly. It's secreting all those things. That's why it's neuroendocrine and cell line.
Interesting.
Okay, this one here.
Man, I thought it was way simpler than it was. 17-year-old boy has septic shock, and they give him that is unresponsive to intravenous ADH. This treatment is discontinued, and high dose dopamine is initiated. Stimulation of which of the following receptors is most likely to be benefit to this patient? And honestly, I just ignored the entire thing. Besides, oh, they're giving him dopamine. What does dopamine do?
Yeah.
And I realized this is where I was talking about, like, I realized septic shock. Like, what does that mean? That means he's having super vasodilation,
Yep.
right?
Vasodilation.
Super vasodilation. And so, what would you want to do to obviously help with that? You want to give something that's going to constrict.
Yep.
So, alpha 1 adrenergic receptors agonists are going to help constrict the blood vessels and make it to where he's not in shock
Yep.
anymore.
Exactly. It's going to help it for sure. So vasoconstriction, alpha ones. All right.
It's so sad. We were just talking, I think we talked about this last time too. Um, the Langerhans
Langerhans.
cell.
Yeah.
And that's what's so funny is that I was like, dude, this is Langerhans. This is Langerhans. It basically just said like, golly, it's so annoying. Which is the most likely diagnosis in this 15-year-old boy? Comes to the physician with 2 days after onset of a headache. Vital signs are normal. Physical exam shows mild tenderness over the right occipital area. An X-ray of the skull shows 2 centimeter lytic lesion in the right occipital bone, and a photomicrograph of the biopsy specimen of the lesion stained with hematoxylin and eosin is shown. And I really didn't know. I obviously knew it wasn't a meningioma. I knew it wasn't an osteosarcoma. And
Yeah.
I
Yeah.
kind
This
of just
is,
said, man, this is tough. I don't.
yeah. I mean, to be honest, I'm not good at these slides either, to be honest. I'm trying to see if I can help you, but man, I'm not good at these slides either. I won't lie to you.
Yeah.
You
Well,
you
like,
kind of
yeah.
have, yeah, you kind of have to read the slide to help you here. I would say, I just know histiocytes are like macrophages. I'm trying to look for like sometimes they have multiple nuclei. I mean, man, I don't want to steer you
Yeah,
wrong.
and they also like generally this is like the Burbeck granules or whatever, the tennis racket looking granules.
Yeah, but
And
they
like this
remember
disease.
those are only in your urine, right?
Those are in urine only. I didn't know that
Yeah.
actually.
Yeah, those are usually in your urine electron microscopy, right? So you can see that, right? Those are like protein things, right? But when you're talking about like this is something different. This is like I think they took a biopsy of kind of the lesion. So you have to see like Langerhans cells are just like presenting cells, right? They're like macrophages and dendritic cells. They present the antigen to kind of your T cells. And so obviously if you have a cancer of that, right, it's not good.
Yeah.
But I mean, I couldn't really tell you to be
Yeah, I
honest.
got you. No worries. I'll look at this one.
Yeah, I would say just kind of take a look at some pictures. I don't want to lead you the wrong way. I'm not the
Sounds
best
good.
at reading those. All right, this one here.
Um, so activation with the following neurotransmitter pathways best explained through rewarding and positive. This is dumb. Basically, I know it asks like which of the following is going to best explain the rewarding or positive reinforcing pathway using these drugs, and I knew it was dopamine, but I had just read that the day before that dopamine comes from the ventral tegmental area, and so I thought it was trying to trick me, and say an endorphin comes from the ventral tegmental area, and I thought it was just saying, oh, that's dopamine, but it was just flat out saying no, dopaminergic from the nucleus accumbens.
Yep. Yep. Man, these neuro questions, they always get me. So,
I
all
know.
right, let's go to the last one here.
Okay. It said, which of the following genetic mechanisms is most likely cause of these findings? I believe so. It's an 18-month-old girl, and she has examination because of macrosomia, which means she's just large, right?
Mm-hmm, mm-hmm, mm-hmm.
And then she weighed obviously that. She is now at the 95th percentile wing. She shows a nevus flammeus on the forehead, which I didn't know what that meant, so I ignored it. A large tongue, and abdominal mass.
Yeah.
And okay, and ultrasound shows a tumor in the left kidney. When you see a kidney tumor with like a kid, I'm always just thinking Wilms tumor, nephroblastoma, and then they confirmed it right there. Mass shows nephroblastoma, Wilms tumor.
Yep.
And it says genetic testing of the patient shows abnormal methylation of DMR2 on maternal LP15.
So that's
Which
the
is the
key, right?
following, yeah.
That's the key, right? Here they're asking you, do you understand what methylation is, right? And that's just imprinting, right? When you methylate or silence something, right, that deals with all imprinting. Heteroplasmy, right, that deals a little bit differently, right? Trinucleotide, or I mean, that's anticipation, but heteroplasmy, right, is usually kind of with your mitochondria.
Well,
DNA.
I thought that imprinting meant like deletion of a gene.
No. Imprinting is silencing a gene.
Silencing a gene. That's exactly because DNA methylation mutes the DNA. It's kind of how I think
Yep.
about it. So
And then
silencing of a
acetylation
gene.
activates, right? Acetylation activates.
Yes.
I always remember this. I mean, this is details, but I remember there used to be questions on this. I don't think they have it anymore. But if you think of like, you have your histone, right? And then you have the spokes of the wheel of your histones, right? What ends up happening, right? And you have your DNA and your genes, right? Kind of
Yeah.
wrapped on your histone, right? If you think of it like that, right? If you methylate it, you have more spokes and it gets tighter to the wheel, so then things can't read it. When you have acetylation, right, it loosens it up so that you have space to read it. So
Okay.
yeah, that's kind of how it works. But yeah,
Cool.
that is called imprinting. So just remember, this is a definition thing for sure. So
All right, cool.